Hi, my name is Dr Renee and I'm a GP. Most people know me as Dr Renee because, let's face it, Hundekamp is a ridiculous name to both say and spell. So, Dr Renee it is, and I'm a busy London GP, but I'm also a medical writer. I write for OK magazine online, where I take a celebrity that has a disease or illness and have a look at what they've said about it and how they're coping. For example, did you know that Kim Kardashian has really bad psoriasis? And thousands of people out there have really bad psoriasis, some of them suffering in silence. So it's a good way to let them know they're not alone, to hear how other people are coping, and to have a look at the disease as a whole and what they could possibly do about it. Then I write for the Daily Express online, where we just take a topic that's current. So for example, it's National Diabetes Awareness Week next week, so I'm writing about diabetes, who gets it, why, how, what to look for, what the treatments are, and how to avoid it if that's possible. Then I have a monthly radio show, which is really fun, on BBC Radio London, with Joanne Good in the afternoon on the first Tuesday of every month. And we open up Dr Renee's surgery, and listeners phone in with just about any question that they have on just about any topic that they have. And for me, it's absolutely terrifying because I don't see the calls before I take them on the show live, and I'm always worrying and stressing that I'm not going to have the answer on a particular day. But so far so good, and fingers crossed it stays that way. And the questions that I get are absolutely amazing in their variety. I get really simple questions, which demonstrates to me that as a GP it's easy to just assume that people know the answers to what we think are simple questions, and that's not true, and why should they? You know, I went to medical school for a long time and have trained for a long time. So it's really important to understand that and to be able to answer every single question, however simple it appears. And then there are the more complex questions, and sometimes I have to go away and research those and come back. But that's a good learning tool for me, and it's good to share that with listeners and readers as well. So it's really varied and it's really fun. But sometimes I notice that we open up the show with one question, for example on the thyroid or menopause, and then the whole show just ends up on that topic. The floodgates open and the questions just keep coming. And that demonstrated to me that there is this insatiable appetite for medical knowledge on different topics. And people really don't have the information all of the time that they want. And that can be for a myriad of reasons. So everybody's really busy now, just trying to make ends meet, and lives have become busier, so they may not have time to do the research or get a GP appointment when it suits their lives. Or when they go to the GP, they get nervous and clam up, and I see that. And as much as we can encourage people to talk, sometimes the questions just go out of their head. Or they've got lots of questions and they just don't get time to ask their GPs, who are busy and have 10 minutes for each appointment. And I see that too. And I can understand how frustrating it is for patients and also for GPs who would love to have more time to answer all these questions. So then it got me thinking, as there is this need for people to have these questions answered and to get the information that they want and to manage their disease, and people do want to do that, and that's to be applauded, then we need to get the information out there somehow. And I wondered if I could do that more than I'm currently doing with the medical writing and the radio. And I thought about doing a medical vlog, a weekly vlog, where I take a topic that you asked me to cover, and I cover it in detail, all of the aspects of it, what causes it, what the treatments are, what the anecdotal treatments are that I've heard about, and you know, it's not all about medication. And I decided that's what I'm going to do. So that's what I'm going to do every week. So there'll be a weekly topic that I cover in response to your questions, and I think that's the most important thing. It's not about what I want to say, it's about what you want me to say. So please, let me know if you've got questions now. You can post them after this video. My first video is going to be next week, and I've already had some questions and requests to cover anxiety. So that's what I'm going to do with my first vlog next week. And feel free to comment after you've watched it, please watch it. And post your questions. Tell me what I'm doing well, tell me what you'd like to see more of or less of, obviously. And also post other topics that you'd like me to cover, and I will cover them as best I can. So that's Dr Renee's surgery, opening up via vlog on a weekly basis, answering your questions in the best way that I can. I hope to see you there, Post your questions and topics after this video today, and let's get going together. Thanks for listening. Bye.